Dr. Pillay, North Lincolnshire CCG IT Lead, GP, Riverside Surgery, Brig. In this video, we are going to learn how to use a shortcut key to print a high-risk letter for patients with Covid-19. The first thing to do is to get into the consultation entry for that patient in question within EMIS. Press your F12 key. The Corona Covid-19 Risk Coding and Shielding Admin shortcut has to be uploaded within your shortcut protocol launcher. So it'll be different based on which shortcuts you have got there. In mine, it's under E. By clicking on that, you've now got a few options, and you would just follow through which option you feel is applicable to this patient. So for example, I believe this patient's had his spleen removed, and I would like to code him as being high risk for complications of COVID-19 and at the same time print a letter. So I'm going to tick that box, and it's going to ask me, do you want to print a shielding letter now? If let's just say the patient has already received a shielding letter, you would just click no. But if you would like to give him a shielding letter, you would say yes. What it'll do next is it'll bring you within the document within EMIS, and it has mail merged and auto-populated that document. I would encourage you to scroll to the very bottom of that document just to make sure that you're happy with everything, and more importantly, double check your sign-off. We have got it to sign off as Riverside Surgery rather than a named doctor. At this point in time, I am going to press save and close. And now I'm going to press save. And what you can see is you've coded the patient as being high risk. That will now show up on the alert bar. If you go into care history, you will see exactly what's been done in terms of coding. You've also got a letter that's been sent out to the patient, and that's been coded over here as well. And you can choose to send this letter out via mail or by using AccuRx.